No one ever said that love was easy. We know in Scotland today we're facing some very real challenges. As I visited CrossReach services, I experienced both joy and sadness. So much joy, meeting people and hearing stories of lives being transformed, that contrasted with a sadness when hearing firsthand about some of the challenges that are faced each day. Challenges of demand overspilling into long waiting lists, meaning a desperate wait for those in need of support. Shortages in funding, meaning deep uncertainty and unease for those trying to make decisions about the best way to manage services. And the knock-on effects of cuts to early intervention services, resulting in, very sadly, more people reaching that point of crisis. At the Scotland Demands Better March earlier this year, we walked alongside thousands of Scots to demand better. I addressed the rally after the event, where I reminded the audience that the role of the church is listening, learning, serving and caring. In all places, this is what we're hearing. This is what people are needing, are wanting. Better investment in life's essentials.
At the moment, the key challenge that we're facing is around resourcing. So that comes in two different ways. We're an organisation that is based on having the right people in place to support those who need us. So the key thing for us is to have the right staff doing the frontline work where it really matters. So we need to find people with the right values, with the right motivation, who will love and walk alongside the people that need us. The other thing that is a constant challenge for us in social care is having the funding in place to do our work. So we're seeing a lot of demand for support, a lot of need in our local communities, and at the same time public funding is always under pressure. There's always a lot of demands for that, so we have to speak up and we have to argue for it, and we have to fight to show that the work that we do is essential for society, so that we have the right funding to do our work.
The challenges of working in health and social care are well rehearsed, but it's important that we don't lose hope. We have a voice and we can and must use it to influence change. We're in a privileged position at CrossReach as our services span different age groups and offer support to people with many different types of need. We also work in a variety of geographical areas covering urban and rural environments. We're therefore able to gather a good picture of what's going on nationally, and it's important to us that we do use our voice, informed by the experiences of our people, to speak up on behalf of all of those who are in need of support now, or maybe in need of support in the future. We often collaborate with other voluntary sector organisations through CCPS, the Coalition of Care and Support Providers in Scotland, and we work together to help articulate the challenges and offer solution to those in leadership positions or tasked with developing policy. As we approach the Scottish elections in 2026, we'll be particularly focused on sharing what is important to us. High quality care needs a skilled, trained and valued workforce. So we will continue to advocate for fair work within social care as a primary concern and a key challenge for our government to address ahead of and as part of the wider reform that is much needed. In the new year, we'll be sharing more about all of this with all of you, and I would welcome all the support that we can get to fulfil our aspirations for a Scotland in which all can thrive.